Hi, I'm Janelle from Project School Wellness, and I'm here to talk to you about what is sexual health. So, we tend to learn about sexual health in quite simplistic terms, and we're taught that if we prevent pregnancy and we don't contract or spread STIs, and as long as we're asking for consent, then we'll be sexually healthy individuals. And while those things are incredibly important, they don't tell the whole story of what it takes to be a truly thriving, sexually healthy individual. So, let's take a look at a little bit of a more detailed definition of sexual health. So, sexual health refers to embracing and enjoying your sexuality throughout life by building confidence and security in your identity, having healthy and positive sexual experiences, nurturing, enriching relationships, exercising autonomy over your sexuality and body, keeping your body clean and free of infection, and working at an optimal level. So I know that that is quite a lot in one definition. So I'm going to break this down for you. I'm going to look at each definition or each element of sexual health, and then going to share some different examples of what this would look like. And I just want to clarify that when I talk about the elements of sexual health, I'm really referring to what I believe are the pillars of sexual health, and that to be truly thriving, to be a thriving, sexually healthy individual, then you need to intentionally strengthen each pillar of sexual health, or the elements here that I'm going to explain to you. So, just to reiterate, the elements are confidence and security in your sexuality and identity, healthy and positive sexual experiences, nurturing, enriching relationships, and exercising autonomy over sexuality and body, and then keeping the body free of infection and working at an optimal level. So let's break those down, starting with confidence and security in your sexuality and identity. So what this looks like, or may look like, is you feel comfortable and free just being you. Whether that's, different aspects of your identity, or more specifically your sexuality and your sexual identity. 2, having a deep understanding of what you need and want, and having the confidence and language to express yourself. Now, it's really important to understand that your needs and wants are going to change throughout life, and that is totally normal, but we want to make sure that we're taking time to reflect and really understand what our changing needs and wants are throughout life, and then being able to express those. Healthy and positive sexual experiences. So, this refers to the ability to engage in sexual experiences either by yourself or partnered that are healthy and pleasurable, not only in the moment, but also leave you feeling positive afterwards. So, sexual experiences can be really confusing because, on one hand, they can be pleasurable, but on the other hand, maybe they'll leave you feeling emotionally hurt, or they're emotionally confusing. And you're, even though it was pleasurable in the moment, afterwards, you're questioning it and you're not really sure that it added the value that you wanted it to add to your life. So, an easy way to think about this is that just truly healthy and positive sexual experiences, they are going to feel positive and pleasurable in the moment, but then afterwards you're still going to continue to feel positive, and that pleasure, the pleasure is still going to be an appealing thing even after the fact. And then also, a healthy and positive sexual experience is one where you always feel safe, understood, and valued. And it's important that you understand not every sexual experience is going to be perfect. There's going to be funny, awkward, embarrassing times, but at no point should you ever not feel safe, understood, or valued. Then we have nurturing, enriching relationships. So this relates to, you feel safe, secure, and happy in your relationships, romantic and otherwise, that you have the social skills and competencies to build and sustain healthy relationships, and then also just being in relationships that add value and meaning to your life and are truly a place of comfort and freedom. And so, building enriching relationships is not always easy, but if we really focus on what adds value and meaning and purpose, and where we find safety, security, and happiness, and stick to those relationships, that will help us nurture enriching relationships. Then we have exercise, autonomy over your body and your sexuality and body. So this is having control in terms of how you express your sexuality, being able to engage and not engage in sexual experiences of your choosing, and understanding consent. So consent is a critical part of sexual health, but it is much more complex than we're often taught. So we're often taught that, okay, ask for consent and either grant or deny consent, and then you're good to go. But the problem is that consent requires a deep understanding of another person. It requires a deep understanding of ourself, what we want and what we don't want. It requires a confidence and comfort in expressing ourselves. It requires freedom to express ourselves. All of these deep layers of consent make it incredibly complex and complicated, and part of understanding or being able to exercise autonomy over our sexuality and body is understanding how complex consent is and taking time to truly understand it and to understand the people, ourselves, and the people we're engaging in sexual experiences with, so that we can always establish consent. And then having access to the information, services, and products that empower a person to take ownership of family planning. So that would be access to contraceptives and birth control, and access to medical providers that can help guide you through these different questions and connect you with services to get the right products so that you can have ownership of family planning. Then we have keeping the body free of infection and working at an optimal level. So what this relates to is having access to the information, services, and products that prevent the spread of sexually transmitted infections. So that would be having access to condoms, having access to testing, and having access to treatment if you do contract an STI. And then also having the ability to navigate that situation in terms of interpersonal communication skills. Then having a medically accurate understanding of sexual functioning and the sexual response. So understanding how the body actually works, not how it's presented to work in media or pornography, but how it actually works in real humans. But also understanding that humans are complex and everybody's different, and people's bodies are going to respond and act in different ways. And so it's really important to understand what true medically accurate sexual functioning looks like and the sexual response. So, this would be things like understanding what an orgasm is and how a person achieves orgasm, a medically accurate understanding of that, understanding, what erections are, understanding what the different body parts are, understanding, what sperm is and ejaculation, and understanding what arousal fluid is. All of these different things are part of sexual functioning and the sexual response that we need to have a medical understanding of that, not just assumptions based on what other people have told us or what we've seen in the media. And then we have access to trusted medical providers to help you if your body isn't working at an optimal level. So as humans, we are sexual beings, and our bodies are programmed to work in terms of sex and sexual functioning and the sexual response. And that means that sex should be pleasurable, it should be fun, it should be connective, it should be a positive experience. And if it's not, some of that might depend on who you're engaging with sexual experiences, or who you're engaging in sexual experiences with. But sometimes that can also mean that something is maybe not working the way it should in our body, or it could mean that maybe we have an emotional or psychological situation that we need to work through. And so understanding that sex should be pleasurable, that sex should be this positive thing, and then seeking help from a trusted medical provider if something isn't working the way that it should. So as you can see, true sexual health is multifaceted and it's very complex, just like humans. So it's important that we understand that to be sexually healthy, it's not going to be just this simple, quick fix. It's going to take intentional work related to each of those different elements of sexual health. So just some things to think about. So to boost sexual health, we need to intentionally strengthen each element of our sexual well-being. As we boost total well-being, it will also enhance sexual well-being and vice versa. So the more that we strengthen those pillars, the more that our overall well-being will improve, because sexual health really plays a deep, important role in our overall well-being. And then also understand that sexual health relates to a variety of areas of life, dimensions of health, and health skills. And then just always remember that humans are complex and complicated. Therefore, sexual health is complex and complicated, and that's just because it's part of the human experience. And what that means is that to be sexually healthy, it requires thoughtful action, reflection, connection, working on strengthening your various health skills and social skills. Basically, just understanding that sexual health is complex and complicated, and it's going to take work for you to establish an optimal level of sexual health in your life. So, how do we strengthen sexual health? Well, just kind of the quick spark notes. Thoughtfully consider the different elements of sexual health and intentionally work to strengthen each element in your life. And then also, I recommend just taking time to honor each of the different elements and not prioritizing one or the over the other, and just recognizing that sexual health is comprehensive and that it relates to a variety of things. And then I just want to leave you with one message that's just everyone deserves sexual health. So no one should have to go through life without living an optimal level of sexual health. And it's important to understand that sexual health is going to look different for everybody because everyone's sexuality is different and it's unique, and what you want and need, it could be totally different from your friend or even maybe a partner that you're with. And so it's just important to understand that everyone deserves sexual health, and it's this thing that requires intentional work, but it's something that you all deserve and should all take time to intentionally strengthen in your life.